Director for Saskatchewan and Manitoba, and I will be your host for this evening's session. This is the third session in our speaker series, and tonight's session is Living with the Fear of Dying. So Jennifer Turner works at the Ottawa Integrative Cancer Centre as well as in private practice, facilitates virtual support groups, and also provides individual psychotherapy and coaching. As a cancer patient herself, Jennifer understands the full experience of living with a diagnosis. So Jen, I just want you to know we are so grateful to have you with us this evening. I know that you have a tremendous amount to share with us tonight, so I'm going to turn it over to you.
Thank you so much, Stephanie, and thank you for letting me be here. So I'm going to share screen if I can do that. Let's just see how this goes. There we go. Stephanie, is everything okay? You can see what I'm doing?
All good.
Okay, great. So first of all, I just want to say hello to all of you and thank you so much for sharing your time. And I know that this is a challenging topic, and I know that there are other places that some of you could be this evening or this afternoon, wherever you are. I think it's an important one, and I'm very grateful to have you all here and to have all your energy here. So I just wanted to, I wanted to start with why do we need to talk about dying at all? I mean, we live in a culture that doesn't really support talking about it. Why is it something that we see value to? Or, you know, especially when you're really sick or when you're in treatment, you don't have the energy really to talk about it. And when you're well, a lot of the time we don't want to talk about death or dying because we want to focus on living. So I thought I would start off with why we would do this. So I guess Stephanie shared that I'm a cancer patient, and I've had two parents with cancer and a daughter-in-law with cancer, and I live with a bit of uncertainty. Well, I live with a lot of uncertainty, the way many of you do. So professionally, I've been supporting people who are dealing with life-threatening illnesses and sometimes dealing with the knowledge that they would die for a long time, over 30 years here and in Australia. Being diagnosed with cancer, of course, made it personal. And I've had a lot of time to think about why this is important, not just as a community, but for individuals. So this part I'm going to talk about from my personal perspective, why I think it's important. I guess I wanted to be able to wonder about what dying meant, to be able to make plans that I needed to. Hopefully I don't need these plans, or nothing will need to be put in place for many, many years, but I don't know that. So to be able to think about what was really important to me, to my family, while I'm well enough, and it's still distant enough that I'm not emotionally as overwhelmed. Don't get me wrong, I've been very emotionally overwhelmed, but I am not dealing at this point with an imminent knowledge of my death. So I wanted the space to be able to start to do the work that I knew was important professionally. I wanted to remind myself that this is the present is the only time I can really, really count on. So being aware of dying means that I pay attention to the living. I may pay attention to being here. It helps me keep my priorities straight. It really enhances my appreciation. And sometimes, yes, I still wake up at 3 o'clock in the morning with that, you know, hand around your throat feeling. But I'm doing the work, the best that I can to do the work that I need to do at this point. I've always thought it's so bizarre that we prepare for every other stage of our lives. We talk about partnering and about parenthood and careers, but we all know that we're going to die at some point, and we're never allowed to talk about it. So I guess my hope is that by talking about it, we kind of break that taboo a little bit. It's not that it's necessarily imminent. Talking about it isn't going to make it happen, but it means that we maybe are able to be a little less clenched and have a little bit more wisdom and grace by the time it is our dying time. So I hope that brings a little more oxygen into the conversation as we go. Okay. So the goal here was to create a safe space to talk about dying. I work with cancer patients all across Canada, actually all over the place in United Kingdom and Australia and United States. And there are some things that just themes that just keep coming up again and again. So I'm going to share some of those with you. Some of the questions, what are some of the challenges of living with a life-threatening illness in a very death-phobic culture? In the West, we don't like to talk about death and dying or sickness. We like to stay positive. Why are we afraid to talk about dying? We're going to address that a little bit. Why are they, it seems obvious, but some of them not so much. And what are some of the common fears that people have about not just talking about dying, but actually dying? Having worked in palliative care for many years, I noticed that there are certain things that once people know that they are terminal or they are dying, that they really need to talk about. And these things come up again and again. And then I'm going to spend a bit of time past the halfway section talking about different approaches of working with the whole concept of dying. There's not one way. Some people are going to be very spiritual. Some people are going to be very practical. So there are 3 or 4 different approaches to doing some work that I thought would be interesting. And then what does it actually mean, to live fully with the awareness of death? It seems like such a contradiction. What does that mean? How can talking about death or the knowledge of death or the wisdom around death enhance our experience of living? But we have evidence that it does. And then finally, what does it actually mean when we say somebody died well or somebody died wisely? Of course, these things are deeply personal, not the same for all of us, but it does warrant thinking about. So when we're talking about death in the North American culture, we're talking about dying in a largely secular society. We're not a deeply religious culture in the way that some are, and I'm not saying that there aren't people who are deeply religious, but just that our culture tends to be more secular. And Dietrich Walsuk made the statement that it's impossible not to have faith. We all have faith in something, but the question is, what do I place my faith in? And I like the questions here: culture, medicine, prayer, denial. So when we look at in a Western culture, probably medicine and denial are the 2 that lead the pack. And culture and prayer, perhaps not as much, although at different times they become more relevant, perhaps. We're talking about dying in terms of practical, the emotional, and also spiritual. So I wanted to take a moment to define the way that I'm using spiritual in this context. And I'm using Pachalski's definition of spirituality because I think it's such a beautiful, all-encompassing one. She says that spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant and the sacred. So, in other words, do you feel that you're more than the sum of your body parts, the white matter or gray matter? Do you feel that you have a connection to people that you love and to the world? It's those connections, I think, and we'll talk about meaningfulness a little bit as well. She also points out that illness, a cancer diagnosis, illness, aging, anytime we feel really vulnerable, we feel mortal, the prospect of dying can trigger really big questions about, who we are, what's the meaning of our life, and then what becomes of us. What does it mean to die? Who am I? And how will I be remembered? And essentially, illness and dying are really spiritual as well as physical processes because they provoke deep questions of, what am I hopeful for? And what do I place meaning in? So I thought that was an interesting way of looking at why this is we have a heightened awareness around some of these things when we can take a deep breath and actually think, and we're not just lurching from, chemo and fatigue and side effects and worrying about money and worrying about jobs, when we can actually fall back into what's happening for us emotionally, spiritually, mentally. So let's just jump in. Let's talk about what some of these fears are. So at the top of the list, whenever we talk about common fears of dying, about dying, the fear of pain, suffering, and losing our dignity. These are, you know, when you ask terminally ill patients, people in palliative care, what they're afraid of, these are almost always at the top of the list. And then we also have to understand that pain and suffering are not all physical. We're also talking about emotional. We're also talking about existential. The fear of being a burden to loved ones also often comes up. And this one, I really, you know, in 30 odd years of working with families where somebody is dying, I have to say, I hear this from almost every patient, and I almost never hear this from the loved ones, from people, from caregivers, because there's such a sense of hopelessness when somebody, of helplessness rather, when you're working with, when you love somebody who's working with a diagnosis like this, that sometimes it's the only thing you can do is to be present and to care, and everything you can do for that person makes people feel less helpless. But I do recognize that it's a common fear. One that people don't talk about as much, but the fear of not being here, just not existing, the fear of the end of consciousness is mentioned somewhat, not as much as the top two. Legacy, this fear of being forgotten. You know, in many other cultures, ancestors play a big role in cultural rites and rituals, and in terms of how you think and the purpose of our lives. And ancestors don't play as big a role in our culture. And as a result, one of the biggest fears that people have is that they will be forgotten. They won't be a part of the family story moving forwards. This idea of meaning, you know, I often hear people say that they want to find meaning at different times in their lives. And the truth is that we create meaning. We create meaning in how we approach parenthood. We create meaning in how we approach our careers. We create meaning in how we approach our death. And we teach our families, our children, what it means to live, what it means to love and be responsible for each other, and when it's our time, what it means to die. There's perhaps nothing more meaningful that we're going to experience or pass on than those things. Of course, leaving the people you love, the fear of your death hurting other people and creating pain for them, and also the fear of you know, our unfulfilled responsibilities, that as a parent, I need to be here. I remember thinking I need to be here until all my children are 40, 50, 60, like where do you pick a number? And then that number goes down 30, 20, 10 for some people. So you're trying to bargain with time, because the idea of not being here for your children and your partners, it's devastating, and we bargain for more time. When people know that, when people have been given the news that this is now their dying time, there are certain themes that come up that people talk about a lot. And at the very top of that list is feeling alone. I think we have the sense that a terminal diagnosis means you're plucked from the rest of the healthy world, where people are able to plan, you know, for next year and 10 years from now and their retirements. Even though a lot of these things may never happen, they have the innocence of thinking that they will. So knowing that you have a prognosis that's very challenging, or a terminal diagnosis, it can be very alienating. It feels really alone to be living in that. Those moments in the middle of the night where you're really grieving the loss of that innocence, I don't think there's a more lonely experience than that. And that is why organizations such as this, support groups, sisters, people that we connect with who are walking that same path are so important. There is sometimes nobody else that you can say that to. I feel alone in this, because you don't want to hurt or insult the people around you who love you deeply, but can't possibly walk some of that fear with you. They walk their own fear, but it's a different experience. I think not being able to talk about dying, or even wonder aloud about it, is so crippling. It's so alienating, because very often, even if you express, I had a patient say to me last week, she tried to express to her husband that she wasn't depressed so much as she was frustrated, that every time she tried to talk about her fears about dying, or even plans, things that they needed to talk about, because he loved her and he just didn't want to hear it, he wants her to stay positive. So that was too dark. He wanted her to not go there, to not think about it. And as she said to me, does he honestly think it's possible for me to not think about it all the time? What could be more cruel than telling somebody they're dying and then saying, don't think about it and don't talk about it? It's crazy making for everybody and for him as well, because I work with a lot of couples and families where I'm the catalyst to start having these conversations, and it's so painful and so difficult. But then you can see it's almost a relief to be able to really talk about, well, what's important, what do we want to do with this time, where do we want to put our focus, what plans do we need to make. So it's so painful and difficult to start some of these conversations, but such a relief to be able to share them. Yeah, people telling you to stay positive, knowing what to prioritize. People, you have limited energy just being sick, being in treatment, and then grieving the loss of this future that you thought you have. There's limited energy. So how do you prioritize it? Where do you put that energy and that time? Children and partners, I mean, it's the I can work with anybody who can be, I can work with people who can be pretty stoic about anything. But if you talk about our children, our partners, then that stoicism falls apart, because our biggest fear is that we're not going to be here for the people we love. It's our job to protect our children from everything, and we can't protect our children from this. It actually takes a real change of thinking that my job is to teach and support them even through this. And you are teaching them really valuable lessons. But we hate to think that anything about us is taking up, is creating pain for anybody. Sorry. This wishing our partners would really be present with us is sort of part of not being able to talk about dying. It's hard. And when partners don't have the ability, or they're too scared, or they don't have the language to talk to each other in the early days, it can become a big void that exists. It's like two people sitting on a bus bench waiting for a bus to come and not looking at each other and not talking. Everybody's suffering, everybody's scared, but it feels like you're not in it together. And then the other thing is the stress of living on borrowed time. It's very stressful. If you feel I'm trying to pack an entire life into whatever it is, 10 years, 5 years, uncertainty, 1 year, it's almost inconceivable. How do you pack a life into that, and where do you put your efforts and your energy? So Dr. Singer at U of T did a really thorough analysis of what is quality end of life care. What does that mean? And there's a couple of interesting things in there. Again, adequate pain and symptom management at the very top. Nobody wants to be in pain. The second one is interesting: avoiding inappropriate prolongation of dying. Now, it's so antithetical to how we think in the West about death and dying that, if you ask somebody with a terminal diagnosis what they want, and at the top of the list is going to be more time. I just want more time. So with that comes the responsibility that sometimes more time is also more suffering and more fear. So who gets to decide what's inappropriate prolongation of dying? Well, the truth is it should be the person who's doing the dying. The person who's doing the dying has to be at the center of this story, and only they get to decide, when they have the ability and the space to think about these things, where it comes back to, where do you put your efforts? Where do you put your energy? When have you run out of time? When do you feel that it's enough? And in a culture where we do treat patients now, and this is different even from when I started practicing, doctors used to say, we've done everything that we can, you should go home and spend time with your family. I almost never hear that now. We almost never admit we've done everything we can. And in a positive way, we often have new treatments, immunotherapies, we have new things coming, which are very exciting, clinical trials. But at what point does somebody get to say, that's enough. Like it's time. And it was an interesting question that was or an interesting point that was the second thing that came up. Achieving a sense of control. We want to feel that we have some control at a time, especially when we maybe feel that all control was taken from us and we haven't had a say in these things. So having some sense of control over our quality of life, our decisions, having informed consent becomes very important. Relieving burdens, whether it be financial burdens, practical burdens, things that we're worrying about. I mean, my father was so adamant that he couldn't die because the basement needed to be decluttered, or it seemed like such a, to us, don't worry about it, but it was important for him. And so he needed to know that we were going to take care of that for him. And then strengthening relationships with loved ones, which is one of the, if you're in treatment and there's no gaps and there's no breathing space, sometimes we run out of time to do some of these things because we're just not well enough to. So this idea about, not talking about dying, the irony is we don't even really talk about dying even when we are. And that just seems to me to be incredibly alienating. We do live in a culture that does not like to talk about disease or death. We tend to ricochet really quickly to being positive, and exercise and diet and meditation and mindfulness. All of these things are wonderful, but it still doesn't take away from the fact that we are all mortal and we are all going to die someday. So it would seem to be useful to be able to talk about that and to be able to deal with the fear that probably comes up from that. So why don't we talk about dying? Why don't we? So we have this legacy of positive psychology that just says if we stay positive enough, we try harder, we never give up, that we won't die, or at least it's not conceivable that we will, so we don't have to think about it. And I've noticed that we even get angry with people who accept the inevitability of death because it scares us. When people say in support groups, because I do a number of support groups, I'm always really interested to watch the dynamic that happens when somebody says, it's enough. I've had enough. I'm not having any more treatment, or I'm going to request MAID, or which we will talk about further, or I've had enough. Everybody around them, of course, it sort of begs the question, well, what does that say about me? And people get a little bit defensive and angry about it. It's scary. It's scary for everybody in those groups. So I get it. But there are some things, the truth is, we can't really control everything. And sometimes the only thing we can control is our response. This idea, it feels very unfair sometimes. It feels very unfair. I think I said last time, I seeing people lining up outside a Burger King, it surprised me how much rage came up in me, because I thought, oh my God, like I have tried so hard to be healthy, taken such good care. I can't remember the last time I had a Burger King or anything even remotely resembling that. And they look hale and hearty, and I have had such a rough couple of years. So it feels very unfair. When I came to really looking at the literature and the body of work around death and dying, I mean, it's not a punishment. Dying isn't a punishment for not trying hard enough or not being good enough. Neither is cancer. It's just a function of being human. We're vulnerable. We're of a nature to get sick. And at some point, we are of a nature to die. And we all know that from the time we're about 5 years old, maybe 7, 8 years old. And then we just stick it in the closet and we never come back and we never address it again, even when we're dying, even when we're told we could be dying. In our society, Western society often views death as a failure of medicine. How medicalized has living and dying become that we see our death as a failure of medicine instead of part of our lifespan, however unfair that may feel at times? So in our hospital systems, in our way of caring for people, we tend to focus on quantity over quality of life. Even though we talk about quality of life all the time, It is not the focus of our medical care. And current medical models try to delay death more than they're trying to improve quality of life. And I'm not saying that's wrong. I have every hope and intention of being here as long as I can. And I, like everybody on this call, I'm sure, has had a lot of really horrible treatments and side effects. And I want those options. So don't get me wrong. But I also want to be able to value quality of my life, quality of care, especially as I get to the end of my lifespan. It used to be that people lived and died in communities. We were surrounded by people. Death was a natural part of life. Children died, women died in childbirth, old people died in their homes, in their communities. Thank God we've made the advances that we have. And thank goodness for these facilities when we need them. But it means that death is often very removed from us, often in a hospital setting. And the battle in these hospital settings is to stop it, to avoid dying at almost any cost. And so there isn't the space to take a deep breath and think, wait a minute, this might be the time where this is what's happening. What do we want to put our focus on now? The other reason we don't talk about dying is because it makes us superstitious. Fear keeps us in that really miserable place where somehow if we talk about dying, it makes it more likely to happen. I've had so many people say, I'm doing well now, I don't want to jinx it. And as the words come out of their mouth, you almost see them realize, oh, that doesn't make sense to another person who hasn't been in that place. But I'm sure to every one of us it does. When we're doing well, we want to focus on living and life. And I completely, the problem is that we think about death and life as totally polarized instead of two sides of the same coin. So I want to be able to conceptualize my death as the fulfillment of my life and not be so afraid of talking about it that I miss out on the opportunity to imbue my present life with that gratitude or that awareness that I'm not going to be here forever. We don't talk about death or dying because often the people around us think we've given up and it scares them. And I've had that discussion with my husband where he says, I don't understand why you get so dark. Why do you want to talk about these things? And I said, well, that's how I deal with fear. And I do want to say that we are not all the same. And for some people, they think about what they need to think about. They put things in place. I have a client right now who has planned her funeral, planned everything. And her personality is so much that she needs to not keep revisiting that. So I'm not saying this is the only way, but what I'm saying is we are so afraid of talking about death and dying that for the people who need to, or for the times that we want to, we might have to work a little harder to create that space. I think we have medicalized dying, of course, that we live in a modern culture, but we've become experts in physiology and pain, symptom management, disease progression. We know about clinical trials, treatment protocols, but we know nothing about dying. And that is the thing that's going to happen to all of us at some point. So to at least be able to get the support that you need to cultivate some curiosity. I've had a number of people contact me or come and see me because everybody has told them, and we're in a better place now, I have to say, but it used to be they would be given the information about their medical care. They would be given the information about palliative care, but nobody sat and talked to them about how they actually died, what happened to the body, what happened to the mind. I think now we have palliative care where it's available to us, at least, where that information is more easily shared. So I want to talk about a few different approaches to how we work with death and dying, and not all of these. Some people will gravitate towards some, others none, or we're all different. So yeah, I'll just touch on a few of them. So a wonderful doctor in Manitoba, Harvey Max Chochinov, a real character, he came up with an approach called dignity therapy. And dignity therapy, the organization is called Dignity and Care, and you can find therapists all across Canada who do this. And it's basically a series of questions, like an inventory of questions. You meet with the person who's doing this multiple times, and it's a series of questions about your life history, about what you feel is important to you, what you're most proud of, what memories really stand out, what you want your legacy to be. And a transcript or a video is produced that you can leave to loved ones. It's also, even if you decide not to do that, it's also a really interesting way of processing what's important for you now. Where do you want to spend your time and effort? Are there poems in you that you haven't written? Is there something in you that still needs to be expressed? And perhaps, relationships. Are there people who need to be forgiven? Perhaps yourself. So it's a very gentle and beautiful approach to working with the grief that often precedes somebody dying. The question they ask, it's called the patient dignity question. The question they ask is, what do I need to know about you as a person to take the best care of you that I can? And when I came across that, I thought, wouldn't that be remarkable if every oncologist asked their patient that question? Not in terms of, I know their treatment protocols, I know they're busy, I know they've got 15 minutes, but that, what do I need to know about you as a person, would be such an important question to ask. And every doctor, every therapist, every nurse, every person who comes in contact with you, imagine if that was the question that they asked. It would help us be seen as people. And, even if it's something that we ask ourselves, what do I need to express about myself to make sure I get the best care that I possibly can? So I said I would talk a little bit about MAID, and I will. For those of you who don't know, or for those of you who do, MAID is medical assistance in dying. So this became legal in 2016, and I was on a few different committees. I was working in the hospital at that time, and man, this was a contentious issue, really passionate issue for everybody, and it still is. It continues to be. So it's shortened to MAID. It's a medical procedure that involves the administration of medications to intentionally and safely end the life of a person who meets strict legal criteria at the person's request. So it gives everybody in Canada the right to decide when and how they've had enough. As I said, it's very contentious, it's very complex, and it's very highly charged. Many people in Canada have fought hard for the right to decide when and how to end their lives. Other people, even though they might support the principles of MAID, have been surprised at how triggered they are by the whole topic. Again, it brings us back to that support group dilemma. Are people giving up? Should I be giving up? What does that even mean? What does it even mean to give up? And then how does it relate to ourselves? I would say I've had a number of patients who have applied for MAID over the years and then not gone through with it. And I've had quite a few who have applied and have gone through with it. So I have the perspective of working with the patients and then afterwards working with their families. And it is complex and really interesting. For those people who support the legislation and believe it's the right thing and they're proud of Canada for implementing this, the appeal is to compassion, that no civilized person or country would require people to suffer unnecessarily, that it's inhumane. And then we have, of course, always an alternate view that those who are opposed to this shift in our culture, it's not necessarily, I've talked to many people who don't, it's not necessarily that they don't want this legislation to exist, although some people do, but that we're maybe missing the opportunity to bear witness and honor the humanity, if not the sacredness of suffering as the ultimate act of compassion. And this view is based more on what it is that where do we put our efforts again? Some people would have liked to see more resources and education about palliative needs. There was a fear that if MAID legislation passed, that we would have fewer resources available for palliative care. And so it kind of comes down to either the desire for more control over one's journey and one's fate, or the call to surrender to what we can't control. So you can see, and as I said earlier, we're all different. I over the years that I've worked with patients, I realize I can only speak for what's true in my heart and try to have love and compassion for the people that I come in contact with. I don't know what's right for anybody else, but it is important, and it's one of the reasons why talking about death and dying is important, because sometimes people don't really know what they believe or think either until they've had the opportunity to mull things over, share with other people, listen to different perspectives, or just have their perspective, um, a space held for it. So the other thing that's a bit controversial, I guess, I don't know, is the use of psychedelics in palliative care. And I do want to talk about this because as well, because it's definitely a growing sort of movement, and there's been some very interesting research. So going back to the actually in the late 1950s, 1960s, National Institute of Mental Health in the United States started doing some really compelling research about the use of hallucinogenic or psychedelic drugs, medications to aid hospice patients who were coping with anxiety, depression, and the mother of all anxiety, the fear of dying. And so we now have quite, and that research was all shut down and has just recently been sort of re-energized. And there have been some remarkable results around that. When drugs such as psilocybin, MDMA, ketamine are administered, and we're talking about in clinics under medical supervision, we're not talking about the back of a shopping center, that they've had a wildly more successful outcomes than they thought they would, specifically around fear of death and anxiety about dying. And it's, when you think about what people are afraid of, dying, if you look at it as an existential journey, outside of our immediate body, very often terminally ill people, they report that they're experiencing existential distress, feelings of anxiety, depression, profound loneliness, disconnection from other people, and a feeling of disconnection from the world, anger and fear, or even terror at the thought of death, and questioning the meaning of life, questioning whether there's a God, questioning, whether they brought this upon themselves. Were they not a good enough person? Did they make mistakes? Are they paying a price? I mean, things that you think, oh, I'd never think that way. But, in the dark nights of the soul, when people are really scared, it's amazing all the things that come up. So looking at just dealing with death and dying as the physical body dying without acknowledging other aspects that might be actually very comforting would be a loss. So Stanislav Grof, he was the first psychiatrist who looked at ways of improving the experience of dying using psychedelics, and he observed that we had these most mystical experiences around birth-related and death-related fears and experience. He called this an ego death, and this is a little esoteric here, but I really wanted to share this with you because it's really interesting. This idea that the death of the ego being the state of myself that as I understand it. And when that disappears through the experience of being connected to so many other, to so much energy, all of a sudden, a lot of the fear about our physical death can fall away. So many of the people who've experienced in these trials, and now there's a massive trial being done through Harvard Medical School, have said that they feel not a feeling, but a knowledge that they're more than their physical bodies, and that their consciousness isn't limited to their body. Grof called this dying before dying. And the two consequences of that is that it seems to show that it liberates the individual from a fear of death, and that it influences the actual experience of dying at the time of death. Months or even years later. We're not talking about ongoing work. We're talking about isolated, singular experiences, which is really quite remarkable. Many of you might be familiar with Gabor Mate. Dr. Mate has done a lot of work with ayahuasca, which is a plant-based hallucinogenic, and he started doing work with in addiction and discovered that hardcore heroin addicts who had suffered their whole lives had these altered states of consciousness, and then were cured, were cleared of all of this trauma. And not even being able to understand how or why that happened. The question was, would that help with people who were afraid of death and dying? And the answer is a resounding yes. It has been very helpful for people. So just to understand the experience that people have, everybody's different, but these are people, all walks of life. They're people, often people who have never done anything like this before, but they were so locked in a fear of not wanting to die, not wanting everything to be over. And is there a possibility that there's some consciousness after that? So I'd say what they had in common was maybe a seeking spirit or being open-minded. Excuse me. So though everybody's experience might be different, some of the common themes was that they experienced a feeling of being connected to love everywhere, and that it was an overwhelming feeling of being held in a safe way. This understanding their cancer better and not seeing it as the enemy, seeing it as something that facilitated transition, and doesn't mean without grief and pain, but seeing it for what it is and accepting death as a stage of life. I think that it was interesting that after the Johns Hopkins study, they remarked that participants seemed to become much more, instead of depressed, were much more interested in the quality of their remaining life as well as the quality of their death. So connected to that are these near-death experiences that we've read about or heard about. I've attached at the end of the presentation quite a fairly thorough list of references and resources, and there are a number of books in there of people who have had what they describe as near-death experiences. So these are people who have been clinically dead. They've had heart attacks or surgery complications or car accidents, and their experiences were so remarkably similar that even when their hearts weren't beating, that their consciousness was still around, their consciousness was still there, and they experienced things, sometimes tunnels and lights and relatives, ancestors. But there are hundreds and hundreds and hundreds of these documented cases. So it kind of raises the question as to where does our consciousness end? And for many people, it gives them hope that death is a transition to another state of consciousness. It gives them perhaps the possibility of something other than the end of their lives, and for themselves and for their families can be very reassuring. I want to spend a little bit of time introducing you. If some of you may know Stephen Jenkinson, some of you may not. Stephen Jenkinson is a Canadian. He's a teacher, he's an author, and he's the founder of the Orphan Wisdom School. He has worked extensively in palliative care, and he actually left the Toronto hospital in Toronto, the hospital palliative world, because he believed that there was other ways that he wanted to explore working with death and dying. He's the author of a number of books, but these two in particular I thought might be useful to anybody exploring different ways to think about death and dying. So he has a book called Die Wise, a manifesto for sanity and soul, and then a wonderful small book called How It All Could Be, a workbook for dying people and those who love them. I'm going to use his words because he is truly a poet. If you have the opportunity to go and listen to him speak, it's very mesmerizing, and he's brilliant, I think. But his language is really compelling. His book, Die Wise, is about 600 pages. I don't want to put you off, but I don't have the concentration to read sequentially through 600 pages at this point. So what I do is I open it, I'll read a page, or and I have read it a few years ago, but it's beautiful. So he says, the endings of life give life's meanings a chance to show. Dying isn't a punishment for being born. Instead, the world whispers, all we need of you is that you be human now. Our work is to sort out what being human should be in such a time. And by such a time, he means your dying time, my dying time. He also says, when referring to care of the dying, how we care for the dying people in our midst, and how we die when it is our turn, these together are the proving ground, the cradle and the grave both, for every conviction we have about justice and mercy, about the meaning of life, about what love should look like, and what it should do. You see why I'm using his language, because I can't top that. He talks about the focus on pain and symptom management. Our hospital system, I mean, out of necessity, focuses on pain and symptom management. And again, I'm deeply grateful for that. But what he observed in the hospice settings or palliative settings was that the same mentality, not hospice, in the palliative setting in the hospital, the same mentality about pain and symptom management seemed to be what dominated the hospital palliative situation as well. And things have changed since this. We do have more palliative care at home and we have more hospice care, but partially what motivated him to do the work he did was these observations. Early on, I saw that what passed for a fitting and deserved dying was very often sedated dying or managed dying or defeated dying. I saw far too many people with well-controlled pain and symptoms die in a fear anyway, and that antidepressants and sedation were the rule and not the exception. I saw death phobia permeate the care of the dying, that as a culture, we have stripped away the ritual, poetry, and humanity of dying. I discovered that few wanted to die well, fewer still wisely, most didn't want to die at all, and they spent their dying time refusing to do so. So I like that he looks at dying wise as an act of love. He looks at it as many other things as well. But I focused on this part because I want to move into, when I know that it's my time to die, I want to move into it in an expansive way. I want to open into it. I want to learn everything I can about what it means for me to be at the end of my life, to be able to look at my fears and work with them, and to be able to share with my family, with my loved ones, hopefully some wisdom that even though it's sad and even though I don't want to leave, that it's okay. It's a part of being human. It's a part of life. I want to leave them a legacy of moving into something rather than shutting down and being afraid to think about it or talk about it. Dying wise is a thought on thought in a culture that doesn't believe in dying, and it will take about as much courage and wisdom as you can manage to do it. Dying wise is an act of love. Dying well is not the end of parenting, but the fullness of parenting. Not the end of a marriage, but the last great act of a married life. Dying well is a bequest that you leave to those you love. I have a hard time reading that without being emotional because it's so beautiful and hopeful. I don't want the end of my life or my dying time to not have any value or meaning. I want to be able to lean into it and think something beautiful and graceful can accompany me at a time that I am resisting with every ounce of my being right now. It's not my dying time, but when it is, I hope that this wisdom can help me. So I want to look at a scenario. This is about a woman named Maria. This is a real scenario, by the way, although names have changed. Maria has a stage 4 ovarian cancer that has recurred, and she is now considered terminal. Her oncologist told her that she has a 1% chance of a 5-year survival with chemo. Without chemo, her life expectancy was estimated to be about 8 months. Because of her experience at her mother's bedside, her mother had died post-chemo. She felt that she had suffered in a way that she did not want to take that road. However, her children, not her partner, not as much, her children begged her to take the chemo, begged her to look for second opinions, begged her to look at alternative treatment. Because of course, they're hoping that she's in the 1%. It became the entire focus of the family to get mom to continue with her treatment. You know, she didn't want to let her family down. She felt that there were a lot of things that she still needed to do, and she wanted that 8 months, if that was all that she had, to be able to do her life's work at that time. She had things she wanted to do, and she didn't know how to tell her family that because she didn't want them to feel betrayed. and she didn't want them to feel that she was giving up. So as a result, she did the chemo, and how it played out was, neither here nor there in some respects, because once she made that decision, she no longer listened to her own voice. And don't get me wrong, her children loved her and desperately just wanted to keep her here. And she wanted to stay here for her children. But it meant that the time that she had was not spent in the way that she wanted to spend it. And the questions she had she didn't have the opportunity to ask them or answer them. So questions like what is important to her at this point? What does she believe about life and death? What needs to be healed? What needs to be forgiven? What are her wishes for end of life care? They didn't get listened to because she didn't have the courage or the support to put those out there. And she was tired and she was sick. What stories did she want to tell? What gifts did she want to give or things to learn? How did she want to spend the time that was left to her? And I guess, these things shouldn't be ignored, and they shouldn't be left till the very end, because what we have is right now. What we have is we know that we have now, and this is the time that we have for sure. So thinking about these things ahead of time, being able to support each other, to talk about these things and share these things with our loved ones, hopefully more people will have the ability to do things in a way that is important for them. I'm going to talk a little bit about death doulas and palliative care. So some of you will be familiar, just as there are birth doulas, we now have schools in Canada that equip people to work at end of life as doulas, to empower people, to educate them, to encourage them. So just as a birth doula supports the birthing process, a death doula supports people during the dying process. And it really is personal. It really depends on an individual's needs, their beliefs, what it is that they want, and understanding that death is a process that can span months or even years. People can know that they're dying from something that process is a long time. It's not the immediate end of life. Palliative care is an interesting thing in Canada because I've worked a lot of time in Australia, and my family's in Australia, and palliative care there is a much less avoided concept. Here we have this idea that we avoid it, we don't ask about it, or we don't hear about it. Our medical team doesn't often tell us about it in time, really, because you're still in curative treatment. Palliative care is really designated for anybody who is dealing with life-threatening or a terminal diagnosis, and it can provide compassionate, supportive care that's focused on quality of life. End of life care is only a very small part of palliative care, but often when we hear the word palliative care, we think, oh, this is it. This is end of life care. So it can be, but it encompasses so much more than that. And palliative care physicians often say we should have been called in weeks or even sometimes months before. We could have helped address so many of the things that we're talking about now would have been discussed in palliative care. The question, what do I need to know about you to care for you? Most oncologists would say, I don't have time to ask that question. I understand that, but palliative doctors do have time to ask those questions. And it's an important question to ask yourself as well. So this sort of brings us full circle to why we talk about death and dying in the first place. And this idea of death awareness. What is the benefit of this? Why do we want to live our lives being aware of the fact that our lives are not forever? The idea that being aware of our mortality or our impending death, it's both a blessing and a curse, because there's no question that we have pain and suffering and fear and grief when we are forced to acknowledge the end of our life, especially if we're young, especially if we're not at a point in our lives where we had any of the life skills or the experience of having many people around us of our age who have died. These are skills that we're not expected to have, and we don't. And we're also in a culture where we don't talk about it. So yes, these things are painful, but the knowledge that our time is precious, the knowledge that it's a miracle that we're here and that the people around us love us and care for us, that time is so precious. And that's the second part of our lives once we realize that that time is really precious. So there's grief attached to it, but there's also presence, there's also awareness, and there's also gratitude. And sometimes, that sort of softening into the things that we can't control. I had a woman, so I did a support group for in a particular location for many years with terminally ill patients. And I had a woman who joined the group. She was dynamic. She was, determined she was going to beat it. She was not going to be, there was no softening into, she was not going quietly into the night and didn't believe any of her doctors' prognoses. And, she has the right to be fully energized by trying to live as long as she possibly can. I mean, don't we all want that? Most of us want that. And then as she did amazingly well and lived longer than anybody expected that she would. But there was a point at which she came and saw me and she said, I'm getting really tired. I'm getting tired. And I've actually done everything that it was important for me to do. I'm not ready to die yet, but it's the first time I felt that I'm tired. And she came to a group a few weeks later, and we go around the room and, we say to everybody, how are you? Tell us what's happening for you. And there were a number of people who were having bad days, a number of people who were scared. And I looked across the room at her, and by this time, she was by far the sickest person in that room. And when we got to her, she said, I have to say I'm having a really good day. She said, I sat out with my partner in the sunroom, and I felt the sun on my skin, and I enjoyed my cup of tea, and I came in here, and it was a beautiful drive. And she said, I feel peaceful, and I feel well. And I thought, wow, that's where somebody who kind of listens to what's really going on arrives at. And when she did die, and she did die, she died so peacefully and so beautifully. Every person I've worked with has been my teacher. Every person that I've had the privilege of talking to or hearing what they're sharing have been my teachers. And I know that there are ways of moving through this life and transitioning to whether there's nothing or there's more life or there's consciousness that can be beautiful and graceful, even when they're painful, even when they're difficult. It's not either or, it's both. So I watched a show the other night. I probably shouldn't have watched at midnight. It was a very sad show, and it was very sort of disturbing. And then I thought, I've got to put something on that's going to be less so. And there's a documentary about Ram Dass, who's a spiritual teacher, and he's had a stroke. And I put this on, and it just couldn't have been more perfect. I mean, I knew I was doing this talk this week, and then he said this thing, and I thought, oh, that's so lovely. He said, death does not have to be treated as an enemy for you to delight in life. Keeping death present in your consciousness as one of the greatest mysteries, as the moment of incredible transformation, imbues this moment with added richness and energy that otherwise is used up in denial. Death is not an error, not a failure. And my favorite line that he said was, let's all walk each other home. So the only other thing that I want to share with you, because I do want there to be time for us for me to respond to questions or thoughts or anything that you guys might want to share. There's a very, very nice YouTube video, Jennifer James. And if there aren't many questions and we have time, I'm happy to play this. But she talks about some of the things we've talked about in a particularly engaging way. So if you have time and you're going to get copies, I think, if you request, or you can go on the website, Stephanie will tell you, please do look up her TED Talk. It's very interesting. Anyways, that's all I'm trying to limit myself to an hour. I don't have, I'll stop now and then hopefully have the opportunity to answer some questions or thoughts. Thank you all for listening. Thank you for being brave. Thank you for being open-minded and tolerant. And I do know how triggering this is. I will, and I'm sure Stephanie will mention as well, but I will put as part of this, my presentation, my contact information. I know that this topic is triggering. If anybody is feeling distressed or curious or just wants to talk, please don't hesitate to send me an email or a text. And then we are having a follow-up support group this Monday. And Stephanie, I'm not sure the details. I'm sure she'll tell you. I think it's at 7 o'clock as well. But please join us. That's a Zoom talk and it's interactive. And I love doing those talks. And I look forward to seeing as many of you as there is possible. I've attached references. All the books that I referred to and many that I didn't tonight are listed there as well. Okay. Thank you so much.
Thank you so much, Jennifer. Yeah, overwhelming, a lot of information, and you have just such a way of presenting it. So thank you. We do have some questions and we have some comments.
Sure.
Please, I'm going to begin. If you have anything, you can pop it in the question and answer right now. I have a question here. As a survivor of stage 4, I have no pain and no one has talked to me about end of life. Do I dare ask?
Oh, that's a great one. Isn't that interesting? Like when you ask an oncologist, what does stage 4 mean? They'll tell you everything else. I mean, they'll tell you that I'm sure that you have been told that your treatment is as a chronic disease and that it's ongoing and you'll deal with this for the rest of your life. Sorry, Stephanie, can you repeat the end of that? What was the actual question?
Yeah. Do I dare ask? So nobody's talked to me about it, but I'm scared to ask, really.
Well, thank you. Sorry. That's a very personal question. Like I said earlier, there's no one right way to do this. Is it important for you to know what your prognosis is? Is it important for you to know what your doctor's treatment goals are, the treatment plan? And I have really mixed feelings because on the one hand, my personality, I need to know everything. If my doctor's even had a thought, I need to know it. And then I feel like I'm making informed decisions. On the other hand, I have to say, I have worked in particular with a young woman who was diagnosed at 24 years old. At 25 years old, she was stage 4. And she said directly to her doctor, I don't want to know what the inference of that is. I don't want you to put a number. I don't want months, years. I don't want to know that. And she is now 30 years old and had been through lots of treatment and, struggled absolutely. But she knew for her, she didn't want to hear that information. So I don't think there's a right, when you say, do you dare? If it means, do you dare consider what it means to die? I don't think you need an answer from your doctor to do that. I think you can do the work, such as we've been doing this evening. If it's important for you to have a medical prognosis or a timeline, yes. I think it's very, very personal. I'm happy to talk with you further about that, but I think it's a very interesting question.
Thanks, Jennifer. A few more popping up here. If you guys don't mind, if you could please pop them in the question and answer, it's just a little easier for me.
I'll look in both. You look in question answer, I'll look in chat.
Okay, I've got one in chat here right now. I asked my oncologist directly about what does the dying part look like. He didn't want to talk about it. Said I should see someone else. But really, there was nowhere else to go. And I still don't know where to go for this.
Wow. So can I ask what part of the country this person lives in?
Not sure. Doesn't say.
Okay, never mind. So doctors are not always comfortable with talking about dying. I had a patient, I went into the hospital, I met her at the hospital, she had a seizure, and her doctor, I was there when her doctor came in, and she looked at him and she said, am I dying? Is this one of the signs that I'm dying? And he said, you're young, you're strong, you're a fighter, and said, didn't answer her question in any way at all. And I realized, whoa, like this doctor is very uncomfortable giving a young woman the news that she in fact is dying. So I think you have absolutely the right to answer that question, to get an answer to that question. If you feel comfortable going back to that doctor and saying, you know, I did ask this question and you didn't answer it, and I really need this information, it may, and it's a doctor you see regularly, that may be effective. Otherwise, there are organizations, Death Matters, Death Doulas, Doulas of Canada, there are organizations that specialize in that. But your doctor, your GP, even if it doesn't have to be your oncologist, it's part of the proper care of a patient. It's necessary that when you ask a question like that, it be answered. The other thing you can do is through some of the integrative cancer centers, like the one I work with, there are nurse practitioners, there are doctors there who specialize in working with cancer patients and would certainly answer that question. Nurses, palliative care specialists will all answer that question for you.
That's a perfect segue, Jen, because that question actually was from Ottawa.
Oh, okay. So I can certainly help you here in Ottawa. The clinic I work with specializes in doing work around death and dying, and the naturopaths, the doctors, the nurse practitioner there would all be able to help you. If you contact me, I can help you.
Thank you, Jen. I have a few more questions here.
Sure.
This one came in via email prior to the presentation. So it says, thank you for putting on this session, Fear of Dying. I suppose that many of my teal sisters wonder if the fear of cancer returning and the fear that this time I won't make it ever goes away. I'm a 20-year survivor and I still have that fear.
Wow.
Enough, I also at times have the fear that something stupid will kill me after surviving 20 plus years from this terrible disease. Not really sure what my question is. I guess, is it normal to feel like this, and how do I cope with this?
Yeah, and I mean, so much of it also depends on where we are in our lifespan with these things. So the fear of recurrence that never goes away. I don't think that ever goes away. I mean, 20 years, that says it right there. You know, at 20 years is remarkable, and yet it still hangs over your head because nobody can ever tell you, well, that's it, we're done and dusted. It's always going to be there. The fear of dying randomly, you know, that horrible, that really annoying thing that people say to you when they don't know, when they're uncomfortable with your illness. Well, I guess anybody could get hit by a truck. I want to punch people when they say that, because yes, that is possible, but that has nothing to do with the fear that I'm walking around with or you're walking around with. So I think what you're really saying is there's a fear of dying. Like underneath that question is the fear of death, whether it be from your cancer coming back, or you know, something stupid, as you say. As human beings, I think we all have, it's part of our DNA. It's part of a survival instinct that we have a fear of death, but it's also part of our DNA to know how to die. So we need to have the opportunities to get the support to talk about these things for this very reason. I think the fear of dying, when you've dealt with it long enough, just becomes like a sort of little gremlin on your shoulder. It's always there, you're aware of it, but you don't live your life necessarily with that being the driving force. For some people, though, that fear of death anxiety is absolutely crippling. And please, please get some counseling, because it can make a big difference.
Thank you, Jen. I have a couple of questions around psychedelics, so I'm going to ask them in a tier here. So this is the first I've heard about the use of psychedelics to help manage the emotional aspects of dying. How prevalent is this in palliative care, or something that one needs to reach out to get that kind of support?
Yeah, it's a great question. We are on the cusp of it becoming quite available in palliative care. There are clinics in Vancouver, Montreal, Toronto, I think Winnipeg, I'm not sure about in Alberta. And there are studies being done in a lot of the hospitals. So we're right on the cusp of it in terms of actually being used in palliative care in the hospitals. In a more underground way, it has never stopped being used. And ayahuasca in particular in Canada is used a lot. There are a lot of organizations who are pulling together to provide opportunities for people to do ceremony around ayahuasca. And there are organizations that specialize in that. It's a bit of a gray area, but it's also it's decriminalized, but not fully legal. So the people who are taking advantage, I think in British Columbia, maybe that's a little bit more latitude there. And in Ontario now we have more latitude. And if you can say that it's part of a spiritual journey, a spiritual practice, so you can see like we're in that weird place, but hundreds and thousands of people across Canada are accessing psychedelics to be able to deal with fear of death and dying.
The second question, which I think you kind of answered there, and it maybe go province by province, is are they now being prescribed in Canada? But I guess that's
yes.
dependent.
But through even things like microdosing psilocybin has been decriminalized in a lot of places. So these were never like street drugs. These were never I'm talking about psilocybin, especially in ayahuasca. They were always used in ceremony and as part of healing. But the drugs like ketamine, I'm trying to think what was the other, I lost my train of thought there. Ketamine is being used because it's a pharmaceutical drug. It's being used in a lot of clinics. DMT is being used in a lot of clinics. So I can't speak for where you are. You'd have to do a little bit of research. But I maybe can, I'm thinking of a couple of different organizations that would probably have that information, what's available across Canada and different provinces.
Thanks, Jen. I have one final question here. Again, we do have a few more minutes, so if you have anything, you can pop it in the Q&A. This was another one that was emailed in prior to. I completed chemotherapy for ovarian cancer in July of 2020, and I'm currently in remission. I'm very grateful to feel my normal self right now, and I'm consciously making the most of it. Because of that, I find myself very reluctant to engage too fully in the conferences and educational opportunities that are being made available, although I appreciate that they're there. I think I'm afraid of being overwhelmed about what the future holds. However, I feel a little guilty that I'm not taking advantage of these opportunities. Am I wrong to think this way? In some ways, I think it would be good to have some coping strategies in my back pocket in case I need them in the future.
That's a great question. Thank you so much for sharing. Well, I know that every one of us is going to need some of this in the future. It's just how far into the future and under what circumstances. I totally understand what you're saying about being well. I think I touched on that actually, that when we're well, when we're not in treatment, when we're feeling well, we're in a pandemic, but we want to go to Mexico, we want to go to the lake, we want to go to the cottage, we want to ride our bikes, we want to do everything else. And when we're in that cancer world in treatment, especially when we're first diagnosed, we're just trying to get all the information. As soon as we start to feel well, a lot of us don't want anything to do with the cancer world. And I understand that. I work in the cancer world. And when I was finished treatment, I had to go back to work. And I thought, I don't know if I can do this. I felt a reticence to even go back into that world. And then I realized, hang on, I never left that world. This whole world of, health or disease, life or death, they're not two separate polarities. They're not, two things that are wildly disconnected. They're two sides of the same coin. So the programming, I understand. There are some times where you're not going to want to sit and listen to certain programs, or you'll know when the time is right for you to ask certain questions, when it feels emotionally safe for you. Because never underestimate how traumatic the diagnosis and treatment is. It's a huge life trauma. And most of us need some work to actually be able to process that experience, what happened to us, diagnosis and treatment, and the dealing with fear. And if when that ends, we then just put it all away, the danger is that we don't actually process it in a way that facilitates some deep emotional healing. And part of dealing with cancer, part of giving your body the best opportunity to respond well to treatment and to heal, is to clear some emotional trauma and pain. So I would say it's important not just to have it in your back pocket, but in whatever way serves you. And here's the thing, it might not be through educational programming. That might not be the thing that you need. You might need to spend more time in nature. You might need to read I went through this period where I read all these memoirs of people who had died. It was heartbreaking, but it was sort of what I needed to do to come to terms with the fact that many, many, many people have had to walk along these paths. And, even in terms of reading or understanding about people who are dealing with other tragedies, other things, I was drawn to understanding where resilience came from. So maybe the thing that's going to feed you and give you something in your back or your front pocket is learning about resilience or faith or whatever it is. Allow yourself to approach this in an individual way and take advantage of whatever speaks to you, but don't let it be from fear that you don't do these things.
That's excellent. Thank you, Jennifer. I was going to say, I said that was the last question, but there's
No, it's okay. We've got time. I'm not.
Follow up here to psychedelics. How do we go about finding groups that provide them?
Gosh, that is such a good question. I wish I could be. So I can only tell you what I did because I explored ayahuasca and I had no idea. It's so outside of my comfort zone. I had absolutely no idea how I would pursue anything. I looked for a university program where ayahuasca was being studied and where there were people writing papers on ayahuasca. And I contacted one of the people who had written a paper on ayahuasca. And I said, I'm a cancer patient and I need to know more about this. What do I do? And he said, I will put you in contact with the group who runs these ayahuasca retreats. And I said, amazing. And then the next thing I knew, I got an email from this group and they invited me to come and talk to them. And then I went on this retreat. So I went looking for them. And I wish I could say it was easier than that. I suspect, depending on where you are in the country, at that time in Ontario, there was very little. I know for a fact that British Columbia, there are a lot of ayahuasca ceremonies happening. I know that in Ontario now there are. I know that in Quebec there are. I don't know about Alberta or Manitoba as much, but I will if people are interested in. I only know the ayahuasca community. I do know of a clinic in Toronto that's doing ketamine and I don't know what else, psilocybin. So if people are interested, I will contact both of my contacts in those areas and just say, can you give me more comprehensive way for people who might be interested to reach out and find out? I can do that if that would be helpful.
Thank you. This is great. We're getting some really great feedback here, Jen. There's a couple more questions, but I just wanted to read some of the thoughts that we're getting to. I was really hesitant to participate this evening, but thank you. You have brought out more strength than weakness in me. Thank you so much for walking with us. Another comment here. Thank you so much, Jennifer. I'm so appreciative of your presentation talking about death and dying and opening up a dialogue that is fearful for all of us. Just having this opportunity to talk about a subject that seems so taboo is so freeing. Thank you.
Oh, that's wonderful. Thank you so much for that feedback.
So I have two more questions and then I really will cut it off. Sorry.
No, we're not in a hurry. It's fine.
It's hard when there's so many great questions. I have had 4 recurrences in 5 years. When I knew that I only had maybe 5 years, I did a bucket list. My last chemo, the tumors did not shrink. So now I think this is the beginning of the end. I try not to think, but the isolation of COVID has made it worse. My son couldn't sit with me in chemo. I'm so sad.
Oh.
More of just a comment.
Say that again, sorry.
I said that was
a comment. So this is, I just want to say thank you for being so honest. And thank you for acknowledging that sometimes sadness it's so overwhelming. That's where we sit with that sadness. The feeling of this being the beginning of the end. I've had so many people, that language, is this the beginning of the end? Is this for me where treatment ends? I would say is maybe a more helpful way of looking at it. Can I just say that it's partially why I do this work, because I want to be prepared that when it's the beginning of the end of my treatment, when it's the beginning of the end of my believing that I can cure my cancer, that realistically that my physical death is going to be front and center. then it's the beginning of my real spiritual work, my real emotional work. It's the beginning of me really leaning into where's my support group? Who can I lean on, and who can I share with? And where do I find the support to think about what this time means to me? That it's not just a loss, that it's also beautiful, and it's also deeply spiritual. And if you don't have those people in your life, please reach out. Please reach out, because this is the community that I work with, and it can be an incredibly enriching and uplifting time. And I don't want you to ever feel that you're in isolation in your sadness. I can see the next question. Do you want to read it out? Oh, I can't hear you. Yeah.
Either. And this is a great question. I think a lot of people will find this really helpful. I really feel that my husband and my son would get enormous value out of listening to this and to better me and understanding me better. Is there any reason that I shouldn't share the link to the video with them?
Oh,
and
my
is
gosh.
there a good way to present it? Great question.
It's a great question, and absolutely, please share it. These are such opportunities to open up a discussion. And I think the family members, partners, they don't understand sometimes that that there needs to be more oxygen around different ways of looking at this, because their job is to just, they believe their job is to just keep you alive and support you in treatment and keep you positive, and sort of forgetting that you're more than just your body. You're more than the sum of your body parts. You're also an emotional person and a spiritual person, and they can't go all the way with you, but they can support that. So I would absolutely share that. I do, I haven't done for a little while, but I do groups as well for support people, for families, for kids, and for husbands, and even sometimes for parents, because when you have young people dying, the parents, man, I mean, that's not in their minds, this is not the natural order of things. We think we have a natural order of things, even though we really don't. So yes, please do. I think if you feel it would be helpful, absolutely. And then you can extend also to them. Please, if have any questions or they're in distress, they can reach out.
Thanks, Jennifer. So I think that brings us to close for the questions this evening. I just want to really tell you, thank you so much. That was a fabulous session. It was just awesome to be able to create a space where everybody felt open-minded and free and really able to listen and share about a topic that's not normally talked about. So thank you for sharing with us tonight, Jennifer. A reminder that session was recorded. It will be up on our website here by the end of this week. And I also wanted to remind everybody tonight that we do have a follow-up session. Jennifer will be leading a support group on Monday, April the 26th. It will start at 7:00 p.m. This will be more of an interactive Zoom call. So we will be able to chat and to share and to see each other's faces. So please, you're most welcome to join us on that. That's Monday the 26th. You will receive an email tomorrow in your thank you email that has a link for the Zoom call on Monday. The other thing I did just want to remind everybody about is we do have an online group called Of Dialogue, and every Thursday they host a Teal Thursday. That's 1:00 Eastern time. I think there is one of these going on tomorrow, and based on tonight's session, we may have some great dialogue in that. So you can log into the site and click on the discussion title. That's under Of Dialogue. That's tomorrow at 1:00 Eastern. So finally, I just want to say that we are so thankful to be able to put on these sessions and to connect people from across the country. But really, we need your feedback. It's extremely important to us. It helps us to shape future topics and find out what you really want to hear more about. So I have included the link for the evaluation in the chat box. So you'll see it in there. you can click on that and complete the survey. Otherwise, we will send you a link to the survey in that email tomorrow. So you will be getting that as well. So again, on behalf of all of us here at Ovarian Cancer Canada, Jen, we want to thank you for joining us tonight and sharing. And I want to thank all of you across the country for having the courage to join this session tonight. Thank you so much.
And Stephanie, sorry. I just wanted to say that this, just the thought that this creating a safe space for talking about death and dying, that if you find that there are enough people who want to continue this conversation, maybe once a month or once every 6 weeks or so, that I'm very happy to do that.
Thank you so much, Jennifer.
Good night, everybody. Thank you so much.
Thanks, everybody.